the next round of topics that we're going to talk about in the Am I Okay series is male body parts. So I have started this little mini series just because I get a lot of questions about, is this normal? Am I okay? And I want to provide some reassurance and or make some recommendations for particular findings that deserve a visit to the doctor. So on to male body parts. First body part, penis. So I get this question all the time. What is a normal size penis and what is too small? So technically speaking, and this is medical definition, a micropenis is defined as 3 inches or less when erect. Now this is a full-grown adult male penis, okay? So this is when you've gone through all of puberty, and erection from pubic bone to tip is less than 3 inches. That defines a micropenis. Anything less than that can be normal. And there's a huge range. So there's a flaccid penis that might be a little smaller but grows when erect beyond that 3 inches. There's also a penis that might be baseline a little bit larger and doesn't grow all that much during erection, but is already beyond that 3 inches. And so just keep in mind that there are a variety of penis sizes and lengths that are completely normal, okay? So what to do if you are concerned that you do have a micropenis, so something that's less than 3 inches. I would encourage you to talk to your doctor, okay? There are some medical reasons why that might be the case, and so we can do some testing and make some recommendations and potentially help if the situation is that you in fact have a micropenis. But a lot of people confuse the medical term micropenis with an actual small penis, and it's not the same thing. Okay, so micropenis in the medical world is specifically defined as 3 inches or less when erect. Anything beyond that, probably totally fine, and that's okay. Next topic relating to penis is penis shapes. Okay, so penises come in a variety of shapes. There are some websites that list like 20 different kinds of penises, and I'm not in the medical world. Shape really doesn't matter. I mean, there are medically defined shapes of penises really aren't a topic, but there are a few things to keep in mind. So first of all, I want to provide some reassurance in that if you have a penis that is larger at the base and gets smaller at the tip, sort of a tapered penis, that can be absolutely fine. If you have a penis that's a little bit narrower at the base and gets a little bit wider at the tip, also completely fine. If one is absolutely just same girth all the way up, totally fine. If it curves a little bit to the left, if it curves a little bit to the right, if it curves a little bit up or a little bit down. This sounds like a Dr. Seuss rhyme. Totally fine, okay? The one type of shape that really should be seen by a doctor is something called peyronie's, and that is generally caused by some scarring in the penis that causes a significant bend. So scarring can be a result of many things, including trauma, so if you had any major injury to the penis, or if you've had any excessive rubbing or friction on a certain part of the penis that causes scarring in a particular direction. So that would be, and it would potentially be noticeable to you as well, but what you look for is a bend in the penis, and then there's going to be some sort of generally a stricture, so where the penis gets a little bit narrower at the site of the bend, and that more indicates that there is a little bit of scarring causing this bend. Other things that peyronie's can cause would be painful erections or painful intercourse because of that bend. So that would be a reason that you would want to talk to your doctor. But anything else, any comfortable small bend, totally fine. Well, most penises have a little bit of a bend to them. None of them are perfectly straight. So that's fine, as long as it doesn't cause discomfort with penetration or erection or any other bodily activity, then it should be just fine and you are totally normal. All right, next topic, foreskin. So I talk about foreskin a fair amount, mostly because in America, which is where I am, the foreskin is less of an issue, although it's still pretty darn common. But circumcision is a bigger deal in America than it is in other countries. And so from my perspective, what I like to do is just provide some information on foreskin so that everyone feels absolutely normal, okay? So foreskin is the skin covering that naturally covers the penis when a baby is born. And throughout one's life, that foreskin stretches and loses some of the what we call adhesions, so where it sticks kind of to the penis. And once you hit puberty and have more erections and growth, the foreskin should naturally be able to be retracted on its own, meaning you should be able to pull that foreskin down and expose the head of the penis. Many individuals find that even with erection, that foreskin just retracts naturally. So foreskin. Things that you need to know about foreskin. The one condition that would really warrant a trip to the doctor is phimosis. So when the opening at the tip of the foreskin is too tight and you can't pull it down over the shaft of the penis, okay? Now, the reason that that does need to be seen by a doctor is, one, it can cause painful erections, even painful urination. Urine can get trapped under there and cause bubbling. So a major issue with phimosis causing painful erections and peeing definitely needs to be seen by a doctor. And then the other thing is that it is important to be able to retract the foreskin with cleaning, okay? So in the shower, when an individual with a penis is cleaning themselves, they should be able to pull that foreskin down, clean underneath the foreskin, and then pull that foreskin back up. The reason being is that there are small links of increased STIs as well as penile cancer with foreskin, and the reason being is that if inappropriate cleansing or insufficient cleansing is performed underneath the foreskin, that just means that there's a higher risk. And so we really like to encourage, for both hygiene purposes as well as for keeping yourself free of infection, that you be able to retract your foreskin. But talk to your doctor if you aren't able to retract it fully. We can give a topical medicine that should help stretch things out and make it more comfortable for you. All right, the next topic, testicles. So the balls that hang underneath the penis in the scrotum. So testicles, there should be 2. If you do not feel 2, talk to your doctor. Very basic. Then going from there, usually when you get a little bit older, so late teens, after puberty, it's good to start doing testicle self-exams. So just feeling the testicles for any lumps or bumps. This is to detect any concerning lumps, specifically testicular cancer. But there are other things that cause lumps and bumps in the testicles as well that you should know about and aren't necessarily concerning, but you can always talk to a doctor about. So the first is that there are actual natural at the back, upper, outer edge of each testicle. And that is going to be your spermatic cord. And so basically the collection of vessels that carries blood to and from your testicles, as well as semen. So it carries semen to and from your testicle, not to. It carries semen from your testicles. So that would be maybe a little mound that you can feel on the back of your testicles. Again, the back, underneath, outer edges, completely normal. Sometimes you might notice a little bit of a bump or a cyst in one of those vessel collections, and that's probably something called an an epididymal cyst, so a little bump in your epididymis. Generally fine, nothing to worry about, but if you're concerned, you can always talk to your doctor. And the other thing is that sometimes we get sort of distension of those vessels, so there's a little bit extra blood flow in one of the two collections of vessels, and it can feel like a little bit of a, we could call it bag of worms feeling, but kind of like you can feel like mushy stuff, not on the testicles, but it's like the cord behind the testicles. It can go into the scrotum, and that is something that you certainly want to talk to your doctor about, but it's nothing emergent, nothing that you need to be super concerned about. It's called varicocele, and very common, and we generally just monitor. But the take-home message is that there are a variety of things that can cause some abnormal feelings or lumps in the testicles or in the scrotum, but most of them are benign. That being said, if you ever feel anything on the testicles themselves, talk to your doctor. The other thing to remember is that abrupt onset, so quick onset of extreme testicular pain, should be treated like an emergency too, because the testicles can twist on themselves. It's something called testicular torsion, and that is worth visiting a doctor. There are a variety of things that can also cause acute testicular pain, but a doctor can help you figure out if you have testicular torsion or one of the other issues. But that being said, just remember, testicular pain, emergency. Okay, and the last body part I want to talk about for males is breasts. So gynecomastia, so a little bit of breast tissue, mammary tissue development, especially during puberty, is totally normal, okay? Usually happens sometime around mid-puberty or so, and it can be either just a little extra mammary tissue that you can feel underneath the nipple. You might be able to squeeze out a little bit of like clear discharge. You might actually have a little bit more mammary tissue as well underneath the breast, and that's okay. It's a normal part of puberty that we really don't talk all that much about, but it happens in about a third of those with male body parts. And what I would say is that it usually goes away after a couple of years naturally on its own. If you have persistent breast tissue and you are worried if it's been a few years since puberty and this causes discomfort or self-confidence issues, talk to your doctor, and there are a few other things that we should look into. We could do some labs and then talk about how to make sure that we get that breast tissue to go away. But know that a little breast tissue development during puberty is absolutely expected and nothing to worry about. So that rounds out our Am I Okay male body parts questions. And remember, if you have a question for Ask Dr. T, you can either respond in this video or submit through my website, askdrt.net.